In 2015, Colchester was invited to take part in a film for the launch of the Small Changes, Big Differences campaign. That film at the time was focused on some of the things we were doing with our clinical staff to get them much more involved in how we select and use the clinical products in the Trust. 2 years on, we've really taken those tools and developed them. Staff are much more involved in projects that are happening across the Trust, and I hope today to show you some really good examples of how we've taken that small change and made a big difference to our patients.
The Gloves Off campaign is looking at the appropriate use of personal protective equipment and gloves predominantly. We've introduced these new glove dispensers where you pull one out at a time rather than half a dozen coming out. So it's about quality and also about cost saving for the NHS.
The Pressure Off campaign was focusing on what provisions we have within the hospital and educating staff on how to use them appropriately. We realised that 60% of our mattresses were actually being used ineffectively. So by working with procurement and an outside contract, we've been able to locate all the mattresses and work out if they're being used appropriately. By educating the staff on the appropriate use of the mattress, it means that those patients that need the dynamic mattress are able to get them in a timely manner, but also without reducing the pressure effects of those patients who are on a standardised mattress.
Orthopaedic products are constantly evolving, and we were often being asked by consultants and orthopaedic reps to trial new products. So we set up the group so that a multidisciplinary team was involved in the decision making. We needed to ensure that a quality impact assessment was done before changing any products. We've implemented procedure packs for a range of orthopaedic procedures, including hip and knee replacement, foot and ankle procedures, and arthroscopic knee and shoulder packs. This has considerably reduced the time taken to prepare theatre lists. It simplified training of new staff as there were more standardisation of products in use across the whole orthopaedic consultant body.
Within our oncology and haematology department, we have introduced a new PICC line placement device called the Sherlock. This has helped reduce the time patients spend in our unit and reduce thrombosis risk to our patients. The introduction of our new Sherlock system has also benefited the staff. It has helped enhance their clinical skills to place a PICC line in a safe and efficient way.
I think what we've learned is that a big difference is just not about the cost. It is about improving productivity and efficiency. It's about protecting our staff and making our patient care safer. It's about delivering evidence-based best practice and ultimately improving the patient experience and care for our patients here at Colchester. Small changes continue to make a big difference.